Welcome to Perspectives Online and on air from WFSU Public Media, and I'm Tom Flanigan. This program using the Zoom platform, pre-recorded on Tuesday, November 10th, and we're playing it back on Thursday, November 12th. The show appearing on both WFSU FM on the radio side and the WFSU Public Media Facebook page to keep that online connection going too. Well, boy, I was looking at some numbers here this morning. The COVID-19 pandemic rages on, the numbers rising across the nation, Florida, but also even in the Midwest, which had heretofore not seen the level of infection that we had in the Northeast and in some of the major metropolitan areas. It seems to be spreading apace. And even with this week's hopeful news of a possible vaccine coming out from the Pfizer folks, the threat posed by the virus certainly remains. And for those with certain health conditions that would possibly make them more likely to have an even worse outcome from the infection, we wanted to talk about that, the impact of different age cohorts. There are so many things to discuss when it comes to this situation. So we have a terrific panel put together that is highly knowledgeable on all of these things, and we will find out what their thoughts are to share with you on this today. So let's go around and meet them right now. On screen, Claudia Blackburn, who heads the Department of Health for Florida in Leon County. Claudia, it is so good to see you. It's been a while. You okay?
I'm doing well. Thank you. It's great to see you too. And thank you for inviting me. And special thanks to Dr. Robertson for organizing this.
Well, let's head right down to Dr. Robertson then. Is Gervin Robertson, Division Director of Pharmacy Services at Florida A&M University. Dr. Robertson, thank you for being a part of this today.
Thank you very much for you being able to host us, and we'll talk about and bringing up the idea of just the awareness of not only immunizations and viral infections that plague our community, but how we can reduce barriers for the populations that somehow may be resistant to getting vaccinations and increasing their awareness of the importance, as well as educating the community about the different types of viruses that may affect us.
Of which there are a plethora. Thanks, Dr. Robertson. While we're in the medical community, let's say hi once again to Dr. Paul Robinson, who is the president of the American Academy of Pediatrics, Florida chapter. Dr. Paul, good to see you, sir.
Yes, sir. Nice to see you. I'm actually the immediate past president now. I've been demoted, thankfully.
Yeah, but then you can tack emeritus onto your name and it sounds really neat again, right? Thank you, doctor. And we welcome back to our proceedings Cathy Mayfield, mother of Lawson Mayfield, who lost her life to meningitis. Cathy, it is great to see you too. Are you doing well in this unprecedented time?
Doing fine, Tom, doing fine. I think I'm more challenged on how we get to Zoom and making sure the computer works and making sure I've got an internet connection than anything. But thank you for having me back, and I'm just thrilled to be a part of this panel discussion.
Well, before we start that freewheeling discussion, I was thinking of you just the other night, Cathy, because I was watching some national network TV and I saw the ad, the notice that came out urging parents to make sure their college-age kids are getting that meningitis vaccination. And it immediately popped in my head. I thought, boy, that's what Cathy's been preaching for years.
Oh, thank you, Tom. Thank you for mentioning that. And all these panel members know so well how important our vaccinations are. So I am just thrilled to hear that it's still out there and people are paying attention.
Well, it's a very important thing, but we have so much now to pay attention to. So Claudia Blackburn, let's get that little snapshot here for Leon County. I do see the numbers come out periodically for us. How are we doing as far as the novel coronavirus situation here in the capital region? Are we seeing the same incidence of infection and morbidity and all that as other areas? Or we on some other part of that continuum now?
So right now, our positivity rate is just under 5%. It's creeping up, unfortunately, and we want to get it back down. We are seeing more cases than we'd like, and we still see, the majority of our cases in that 18 to 24-year age range. We've got 2 major universities and a large community college here, so we have a lot of people in that age range, and they tend to not wear masks and congregate and do things that put them at higher risk. So we work with the universities to really get the message out and hopefully get them to comply. Our hospitalization rate here has been manageable for the hospitals, but that's one of the reasons why we want to have this conversation about influenza vaccine, because we don't know what the flu season is going to bring in terms of our hospital resources. So we definitely want to encourage people to get immunized against influenza.
Dr. Robertson, you're right on the front lines there at Florida A&M University there. What do you pick up from the students as far as how seriously they are taking the possibility of COVID-19 infection, both for them and also from family members, if they take off to go home for the holidays or take a weekend off or whatever? Are they really looking at it and going, wow, this is something we have to be aware of and take steps to prevent contracting?
Well, the on-campus environment at Florida A&M University, as it is at Florida State University and Tallahassee Community College in our local community, it has pretty much been altered to our benefit, actually, in Tallahassee this fall semester, because the idea that the universities and the community colleges were not going to bring in a full plethora of new incoming freshmen, as well as the remaining classes of students, sophomores, juniors, and seniors, and graduate students. The idea to improve the idea of all of us for as much as possible to attend classes in a virtual space. That helps to reduce that volume and that space burden that we would have had we have gone back into a traditional classroom environment. So when we think about the idea of the students being involved and the students, the reduction in barriers has occurred due to strategic ideas and strategic advances made between leaderships of our universities and community colleges by not bringing these students into the closed environments of a traditional on-campus classroom. With that being said, I also have a 22-year-old college student myself, and I get more information from him than I do from the students in the classroom. I do think that there is a heightened alertness of the students. When I see students, we have a mandate on campus, we have a mask mandate on campus, we have a social distancing mandate on campus, as does Florida State. At least we try to, those were some things that in Tallahassee that the leadership came together on trying to make sure that as safely as possible, we could bring these students back to Tallahassee and introduce them to the environment without causing widespread viral infections throughout our region. So I think that's helped a lot, in my opinion. Claudia would be the expert on that if we dated it back and trended it in time, if we had that data. Since the students have come back, we have seen some spikes according to our data and our rate from the time the students came back in August. But as we all know, we've seen on the news and we've seen the photo shots, they're gonna gather, they're gonna migrate, they're gonna get together and they're gonna do what students do. We've seen the pictures of the football games and all those things. But I think within reason, when we look at other college towns throughout the country, I think Tallahassee could say that we have not experienced the degree of spread as such places like Chapel Hill, up at Notre Dame. We had not experienced those types where we've had to close off the universities. I've not even heard of any widespread in-house, at least at Florida A&M University, any widespread positivity. I think we did get some spikes over at Florida State, just a little bit. Claudia, once again, might be the expert on what those numbers are. But I think in general, in Tallahassee, our college students have done well with all things, being taken into consideration.
Yeah, and Claudia Blackburn, since you were name checked there by Dr. Robertson, if you could talk a little bit about why students, or actually people of any demographic, should avoid those close encounters that we see not only in college bars, but there are weddings and family reunions and those sorts of things that if you have proximity and you have one or two infectious individuals, you are looking at potentially a very bad situation.
Well, you are. We consider a close contact anybody that's had 15 minutes of exposure within 6 feet or more over a 24-hour period to somebody that is positive. So it doesn't really take that much. And if you're having a conversation and you're within 6 feet, then your risk of exposure is in getting the disease is much higher. So of course, if you're in a crowded space, that's just more likely to happen. People are tired of COVID. They have COVID fatigue and they want to pretend that it's gone. Unfortunately, it's not gone. And we are still dealing with sporadic outbreaks, as Dr. Robertson mentioned. We're seeing them again in those places you would expect, long-term care facilities. We see them in jails and correctional institutions. We see them in fraternities, sororities, dorms, places where people congregate, bars, that's where we're seeing them. So we work really hard to control those kinds of outbreaks and encourage people to continue to social distance and wear their masks. And what we find is that mask wearing really does seem to reduce the transmission. It reduces your risk of getting it, and it reduces your risk of giving it to somebody else. And that could have real implications for flu season if we apply all of what we've learned from COVID, because we haven't had a vaccine and we haven't had a lot of medications. We've just had masks, social distancing, hand hygiene, and isolation. If we can do that, self-isolation, if we can do those things, it will also really affect our flu season. We know in the Southern Hemisphere that and we follow the Southern Hemisphere because they have flu activity before we do, that their influenza rate is way down. And the thought is that it has a lot to do with social distancing, mask wearing, all the things we're doing to prevent COVID.
All right, Dr. Paul Robinson, that brings us then to the whole vaccination situation when it comes to just standard influenza. And I've noticed that a number of providers, whether it is, go to Publix and get a free $10 gift card, or CVS, which in the past had not recognized some insurance carriers when it came to flu vaccinations, are now saying, hey, everybody, we're good to go. It sounds like that the providers have a higher degree of buy-in to this mantra that you gotta have a flu shot if you want to avoid having one bad thing on top of another when it comes to a COVID and influenza infection.
Absolutely. If I could just add one thing to what Ms. Blackburn said, and then we'll go into that, and that just to make sure people understand, she said something really important. She said that you're considered to be exposed to COVID if you have been around someone for 15 minutes in a 24-hour period. So if you're with them for 3 minutes here, 5 minutes there, 7 minutes there, it's a cumulative thing. And an exposure would be considered even if you're wearing a mask. So unfortunately, the mask doesn't necessarily, it is protective and it is important, but I think the CDC would still consider it an exposure if you were within 6 feet of someone who had COVID for that time. So I just thought I'd make sure people in the radio audience understand that new point from the CDC. So the flu vaccine, obviously pediatricians have always been in favor of vaccines. We've drunk the Kool-Aid a long time ago about vaccines. There's no question that vaccines have saved millions of lives in the time that they've been in the United States. And I think one of the things that's hurt them is most people in this day and age have not seen any of the vaccine preventable diseases. And so a lot of people have never seen, say, pertussis or measles, don't understand how bad they can be, diphtheria, etc. With influenza, the problem is so many people have gotten the thought that the influenza vaccine can, quote, give me influenza. You hear all the time, I took that vaccine, I got sick, I'm never going to take it again. Well, the influenza vaccines, are certainly all but the inhaled vaccine, are all dead, killed vaccines. They cannot give you the flu. It's impossible to do that. What's the reason then? Well, the incubation period of influenza is 2 days. So if I get exposed to influenza today, I'm going to be sick on Thursday, most likely. And if I get a flu vaccine today, I'm likely not to be protected for 2 weeks. And therefore, if I get the flu vaccine and then I get exposed to anything else, I could say, even just a cold, I could say the flu vaccine gave it to me. Now, having said all that, go back to your question. There's a lot of concern in our community about what's going to happen when people, particularly adults, but even children, get infected with both COVID and influenza. They both look alike. They both act a lot alike in terms of early symptomatology. And both of them can potentially cause the body's immune system to go crazy. And that's one of the reasons COVID appears to be killing so many people. So we really worry that there's going to be an additive effect in people who get both COVID and influenza that could be even more deadly than we're already seeing with COVID. And that's why we're really pushing people to go on and get the flu vaccine. And I'll stop, but I want to make one more quick point. If you look over the last 20 years, even though flu vaccines are only about 55% protective from year to year, 80% of people who die from influenza have not been vaccinated. And so even if I get the vaccine, it doesn't cover it completely. Even if I get the flu, I'm not as likely to die from it. So it's still an important thing to consider. And
thanks for the clarification. I appreciate that, Doctor. Cathy Mayfield, you, for the benefit of folks who maybe haven't heard your tale before, your daughter Lawson was the picture of health when she went to college. Sadly, that did not prevail. What happened there, and what is your message to the parents of any college-age student nowadays?
Absolutely, Tom. Excuse me. Lawson was 18, super healthy, vibrant, ready to go off to college, and she contracted bacterial meningitis somewhere. She had been traveling with her sister in Europe. She came home. She had a headache. She rode 5 horses on a Monday afternoon. We'd gotten her at the airport Sunday evening. I thought she was fine. She had a headache. I didn't think a whole lot about it. She had had migraines in the past when she'd been stressed and dehydrated and busy. And she went to bed early, 5 o'clock in the afternoon. I went to check on her at 7, and I just was so concerned. She had a huge headache and she couldn't really move her neck. Took her to the hospital. Long story short, she literally, about 12 hours later, she was diagnosed that evening with bacterial meningitis, had a couple of seizures that evening, another few that late the next afternoon, and she was on life support and we lost her. So it can happen that quickly. And what is so interesting to me about now, and what's even more important about our whole vaccine preventable and vaccine information and education, is that bacterial meningitis can look just like the flu, just like COVID. And it's frightening to think how quickly and devastating, because even though bacterial meningitis is very rare, the vaccines are doing their job, it can happen. And if it's not deadly at the same time, the side effects, the repercussions that people live with for the rest of their lives, they can lose limbs, they can lose hearing, they can become deaf. It can be absolutely devastating. And the thought that there is, in many cases, a vaccine that can prevent this disease, it's just unbelievable to me that people still decline to get them and decline to have their children vaccinated and don't realize how important it is. So it's just as important now as it was 11 years ago when we lost Lawson. And I can't say enough of how important these kind of panel discussions are.
And your story is always foremost in our thoughts, Cathy. Just want to let you know, because this is, again, something that unless you see it on TV or you hear an interview like this, you just don't think about. And
No, that's true. And thank you, Tom. I so appreciate that.
okay, well, Dr. Robertson, it brings us to, I guess, the pharmacological and also the epidemiological, if I can say that even, connection between all of this, though. It seems as though we need to really ramp up our capability of providing all kinds of vaccines to reduce the comorbidities when it comes to COVID. So if you are not up on what you need to be, now is the time that you really should address that. But are we set up to handle the demand for that kind of thing, especially in some communities where healthcare is a particular challenge to obtain?
Yes, well, Tom, I think when we get to the aspect of ensuring that there is widespread availability, the first thing that we really need to do is ensure that our high-risk populations are aware that they are high risk. Many of our populations don't understand the high-risk nature of their potential comorbidities. Many don't even know what a comorbidity is. So when we start thinking about the epidemiology and the prevalence of some of the disease states that can be adversely affected, not only by, let's say, COVID-19, which can be, really increase the mortality rate for certain disease states. When we think about just the simple flu, pneumonia, all of those other infections, bacterial and viral, that can cause increased mortality in our area. So when we look at the population as a whole, and we look at the prevalence, those individuals that are elderly over the age of 65. So when we look at that spectrum of patient populations, when we look at the spectrum of patient populations of patients that have diabetes, patients who are immunosuppressed, they may be immunosuppressed because they are a cancer survivor and they're on certain types of chemotherapeutic agents, or maybe even some immunosuppressants for other types of various cancers. Individuals that may have had an organ transplant, those individuals are on immunosuppressive therapies, which make their bodies more susceptible now to any infection or any microorganism invasion. So when we identify that population as a whole, identifying these individuals, are you over the age of 65? Do you have diabetes? Have you had any other type of immunosuppressive disorder, such as cancer, organ transplantation, and the like? Or have you been COPD? Patients that have COPD or asthma, even those are our high-risk patient populations. Let's identify those patients so that they know that, okay, I'm a high-risk patient. I have 1, 2, or 3 comorbidities. Once we identify those patient populations, then we have to ensure, are they linked to some form of care? Are they linked to a pediatrician? Are they linked to an internal medicine physician? Are they linked to some form of care? Do they have access? If they don't have access, how does that patient access Leon County Health Department? How does that patient access, let's say, Bond Community Center? Can that patient access Neighborhood Community Center? How can that patient get care if they don't have a normal physician? Identify the population. Help that patient realize how they can access care, how they can get vaccinations either through their primary care provider or through their local pharmacist. As we stated before, pharmacists can immunize now. Pharmacists have been able to immunize influenza and pneumococcal for the past over a decade now. But now with some new initiatives that have been put in place, pharmacists can do multiple other types of immunizations. So if a patient at this stage in the era of the COVID-19 pandemic, we don't have the vaccine just yet, but the ability to reach those patients when the vaccine becomes broadly available, hopefully by mid next year, we have if the primary provider or the pharmacist that can immunize that patient, that can provide immunizations to prevent any occurrences, hopefully next year. Right now, what can we do 2020, fall 2020? If this patient's a high-risk patient that has multiple comorbidities over the age of 65, has that patient received the flu vaccine? All right. Has that patient received the pneumococcal vaccine? Those are two things, one and the same. If the patient's in a high risk group, and they've not received the pneumococcal vaccine within the last 5 years, they should also receive pneumococcal as well as the influenza vaccine. As we know, that these are vaccines that there should not be terrible barriers to receive, because we know there's about 60% up to 60% and above activity against the virus, but our rates of immunization still do not match what the population needs. So when we identify those patient populations, identify the types of vaccines that we have available and the access to these vaccines, can we make it broadly enough and widespread enough? Currently, we do have the capacity in our systems for influenza and pneumococcal. We have capacity to ensure widespread vaccination for those particular types of vaccines that can help prevent the sequelae that's associated with if a patient contracts, let's say, influenza in the face of a COVID-19, as Dr. Robinson said, that can really set off an immune reaction that sets the immune system off. And once that those autoregulatory signals start firing, that's where that inflammatory cascade comes on, and that's what increases the probability of death. So can we meet the demand now for influenza vaccine and pneumococcal? Do we have capacity? Yes. The awareness needs to be heightened for those patients that are at high risk, and those patients need to be linked to some form of care. So that's the plan that we need, and that's the level of awareness that needs to go moving forward.
And it sounds like, thank you, Doctor, that you, Claudia Blackburn, as head of the Florida Department of Health in Leon County, a lot of that burden is going to fall on your staff to fill those gaps, to provide those vaccines, even public awareness programs. I mean, there's a host of things that it kind of sounds like will be your bailiwick here, and already is.
Well, we're certainly concerned that people access the flu vaccine. As Dr. Robertson said, this year there's been more production of flu vaccine than ever. So there's enough for everybody that wants it. So now it's a matter of how do we get people to make sure that they get their flu vaccination. And I've been in public health for over 40 years, and I have children who are grown now. I still have to remind them because they get busy. And unless you're going to your doctor between September and the end of October or the middle of November, it's not going to be an automatic thing where it's offered to you, or unless it's being offered to you at work. And of course, this year, a lot of people are teleworking. So the usual system of care has been disrupted. So people have to really make an effort to get their flu vaccination. And if they don't know where to go, we say start with your private provider. If you don't have a private provider, as Dr. Robertson was pointing out, a lot of people don't have a regular provider. And if they did, that relationship may have gotten interrupted during COVID. So if you don't have a provider, then you can go to vaccinefinder.org and you can see what's available in this community. Multiple pharmacies, the federally qualified health centers. The health department does have vaccine for insured, uninsured, and underinsured people and children. So there are lots of places to go. And anything we can do to get the word out about that, we'll do it. And we appreciate the county is really assisting with that as well right now. You may have seen some of the ads. So.
I also heard, Tom, that one of the terrible effects that COVID has had is that a lot of our normal vaccinations, particularly with the teenagers and that age group, are not taking place. That the infant rates are pretty good, but it's a substantial decline. Is that correct?
Many pediatricians have seen a fall of 70% and more, and we're still not caught up. And it's because with COVID, so many people are afraid to come to doctors' offices. They're worried they're going to be exposed or get COVID. And I just want to reassure people that your pediatricians, your family physicians, your internists are doing everything possible to keep their offices safe. In my office, for example, anyone with fever or any symptoms that might be COVID, they're actually sent to an office across the street from our main office to be seen with one of our residents, so that people who come here with their diabetes, heart disease, my adolescents, etc., will come up here and should be safe. Also, doctor's offices are doing an amazing job cleaning, making sure that their office is safe. So please go in and get caught up on your immunizations. It's really essential.
We're noticing that in just about all healthcare provider situations now, where in many instances, you call them when you arrive in the parking lot and they will admit you. Essentially, it's almost like a retail situation. Someone leaves, you go in. They keep a real lid on the patient population in those situations so that people can be assured that you are not going to encounter someone who is potentially infectious. But while we're in your neck of the woods, Dr. Robinson, I really am fascinated by the almost complete unpredictability of this particular virus, that it impacts different people in different ways. It doesn't seem to follow the script in so many cases. And again, that throws people off when you have someone who is older, who has comorbidities, and suddenly throws it off in a matter of days, whereas you may have someone who's much younger, more vigorous and vivacious, and it just throws them under the bus. There doesn't seem to be a lot of predictability when it comes to this thing.
Well, we do know that at least in children, only about 10 to 12% get very ill. That still seems like too much. And some of the ones that get ill, we have seen deaths. We've even seen deaths here in Florida, but it's nowhere near the numbers that you're seeing in people my age. I'm 64 and up. So people with comorbidities, as Dr. Robertson has said so eloquently, are at much higher risk, which is why the vaccine trials, I think Pfizer is the only one that's doing trials in children 12 and up. I don't think any of the other vaccine trials in the United States are looking at children. And frankly, that may be appropriate because we really need to vaccinate the adults who are at such higher risk right now and then come back around to the children, given the fact that you can't get everyone all at once.
But also given the additional lethality, Dr. Robertson, within the communities of people of color, that also is a critical need community that has to be addressed on all of these levels. You had mentioned that before, but because of that educational component, getting into some of these neighborhoods where folks just, unless they're really in bad shape, they don't normally have a lot of interaction with the healthcare community. How do you reach those folks and say it is more important for you folks to get protected and vaccinated than just about anybody else at this point?
And if I could add to that for him, how do you convince them that they need to get the vaccine? I mean, especially influenza, and what I'm hearing about what people are saying about COVID, many people are saying they're just not going to do it. And a lot of people in the African American community, the Indian community in our country are doing the same thing. So if you have ideas, Dr. Robertson, we'd love to hear. So,
I think right now, many of my hypothesis is all theoretical, but I would think when I look at the challenge in the institutional environment, and when I look at the pathophysiology of the patients that when I review the pathophysiology of the high mortality patients and those individuals of color, I come back to some levels of focus on some aspects of genetics, which we would probably get to at a later date. When we start looking at immunogenetics, and I might be getting a little deeper into something here that further research would come into, that inflammatory immune response is something that I've become quite interested in with the advent of this COVID, and that enhanced inflammatory response that leads to that when we look at the level of infection and how toxins that are produced by a virus cause the body to respond, and that in my estimation, that overregulation of the immune system then starts to send off something that we term cytokine storm, and those cytokines are pro-inflammatory and pro-coagulatory. That means they increase inflammation and they increase coagulation. So the increase in coagulatory disorders such as blood clots, strokes like symptoms, cardiovascular type complications, those tend to be more prevalent now as we look into as a complication or sequelae of the virus, COVID-19, in our population. You couple that with someone who already has some, they may be diabetic, they may have COPD, they may have cardiovascular disease, they may be overweight or obese, have more sedentary lifestyle. Those individuals tend not to respond. In my retrospective review and my theoretical impression, those individuals tend to respond worse with when I say worse, the immune system tends to hyperregulate, as my review does, as I go back to my review, that hyperregulation of the immune system that leads to this cascade of reactions increases that mortality level. These individuals are more likely to have widespread and diffuse pulmonary inflammation, increased mucus production. That increased thickened mucus production then causes those mucus plugs in the lungs, and those mucus plugs in the lungs decrease oxygen exchange, and the body just can't keep up with that type of force of respiration that's needed in order to push air through. So then that causes these patients to have higher rates of ventilation. And earlier on, the studies did not show that early intubation or early ventilation. It was found out later that let's not intubate these patients quite so quickly. Let's use corticosteroids, drugs like dexamethasone, a little bit sooner into the fray, and they may reduce that inflammation, which can decrease disease. And I think over time, as the physicians and the researchers have learned how to manage the disease using the appropriate therapeutics, we've seen some reduction. Getting back to population, things when especially minority communities, when they do not understand how something occurs, and sometimes there's that, that inability to believe how it will affect you directly. And doing these awareness campaigns, which, I've been on a mission to do this year to increase the level of awareness, and let's reduce those barriers to understanding why these vaccines may help us in the future. And it doesn't help too much when we feel like there's a lack of confidence in the system. Being a person who understands phase 1, phase 2, phase 3, phase 4 clinical trials, I understand that there is a way that drugs are introduced into the market and why we do randomized clinical trials. And there is an importance to the integrity of the system. There must be sound integrity of a phased-in approach, a clear phase 1, phase 2, and phase 3, and those results need time to be vetted, because there are adverse drug reactions and adverse effects that may occur up to months after a patient has discontinued a therapy. So sometimes it takes a little bit for those to vet through. Many people in the minority community feel like, well, I don't want to be the guinea pig. You let somebody else find out what those adverse effects are, and then I'll start taking it. And that tends to be, just in general. So that's why the integrity of the clinical trial process is so important. And that's why an individual, myself being an individual from a minority community, understanding how drugs come to market and how they are approved, relaying that information to our community is important. And it reduces the anxiety associated with drug therapy.
That makes a lot of sense, Dr. Robertson. And unfortunately, you're right. There have been some tragic instances in the past where minority communities have essentially been guinea pigs for some absolutely horrible experiments when it comes to that. But Claudia Blackburn, that brings us back again. How do you reach folks to let them know that, number one, it is necessary for them to have immunizations up to date, to look out for things like the comorbidities that Dr. Robinson and Dr. Robertson just talked about, and that there are some things available to help protect them from further problems when it comes to these diseases?
Well, I think Dr. Robertson and Dr. Robinson, hit on that whole issue of trust. So there's the availability. We want to make sure that it's available. We're out in the community trying to make it available to those people that are at the highest risk. But we also hope that folks trust us at the health department. We work really hard to make sure that the information we put out is truthful, it's credible, people can rely on us for accurate information. They can rely on their healthcare providers in this community for accurate information, and that they also know we're going to protect their information. So we know there are a lot of people who are maybe on the fence about certain vaccines and they have questions. So, how do we address their questions so that they can feel comfortable and know that these vaccines are safe and effective? One of the things that we're doing, we're using COVID actually as an opportunity. We have a prioritized matrix that we're using to help us work with the federally qualified health centers, Bond, Neighborhood, North Florida, to go out into the community to test, to offer COVID testing for populations that are at the highest risk and that are least likely to access the healthcare system in the usual way. So through that process, we're developing trust and we begin to listen and dialogue, and then also make the vaccine available when we're doing testing, if we can. And then hopefully then when the COVID vaccine comes, they'll be ready. We will have built those relationships. So really it's about relationships with the health department, with the providers, and the pharmacists to trust and believe that we would not be recommending something that we didn't think was good for everybody, and something that we ourselves would do, and that we would, I always say when people say, how do I ask my doctor this question? I say, ask your doctor what they would do if it was their mother or their sister or their child, because that's how we need to think about this.
And to talk to people who have essentially been there and done that. And Cathy Mayfield, that's you. Folks who have been through these first-person experiences to get up and say, look, this is not just a public relations campaign that's coming from some government agency. This is somebody's life because it impacted the life of me and my family.
That is so true, Tom. I remember like it was yesterday, being in the emergency room and the doctor telling me of all the things that could happen if Lawson had contracted bacterial meningitis. And in my mind, it was like, this is the healthiest child I've ever seen. I mean, we've never had any health problems. And I thought, she's going to pull through this. She is so strong, so healthy. I never realized how devastating it is to lose a child. Obviously, you don't want anybody to have to realize that. And so Lawson actually died of pneumococcal meningitis, not meningococcal, which is the one that, and the B serum, the B strain that is vaccine preventable. But as we were trying to deal with our grief and find out about bacterial meningitis, to try to figure out what in the world happened, and I'd always associated bacterial meningitis with infants. I just never even realized that it was a possibility that would happen to a really healthy 18-year-old. So looking into that and gathering all the information I possibly could, working through the National Meningitis Association, it was just incredibly interesting to see how many of these strains are vaccine preventable. And that's why I have become so adamant about trying to get people educated, trying to tell them about vaccines in general. And it's been a real eye-opening experience for me to see how people really and truly don't look at the science-based facts. And that's what we've got to continue to get out there. And this is a great opportunity with this whole COVID horrible situation, trying to get the message out there about education and prevention.
And it may be, again, ultimately, as prodigious the amount of information that Dr. Robertson, Claudia Blackburn can bring to this discussion. Until you talk to someone who has had their head and their heart impacted by this situation, They may not believe the government, but they may believe Cathy Mayfield and other
Well,
people.
and that's true. I mean, we live with it every single day, and that will never go away. And you know, my saving grace has been to be able to help people. As Claudia was saying, I talk to my children all the time about, okay, have you guys gotten your flu vaccine? Have you guys done this? Just like their lives are busy. They've got a lot of children. And it's important. And it's just, when you think about the fact that these are actually preventable things, you just want people to understand how devastating it can be when you're not vaccinated.
There's so much more to say, but sadly time grows short. Let's give everyone about a minute to wrap up any final thoughts that they may have. Dr. Paul Robinson, why don't you start us off here, please?
So please get your vaccines and get your children vaccinated. Paul Offit, who is head of pediatric infectious diseases at Children's Hospital of Philadelphia, says that even when there's a COVID vaccine, he would still recommend we wear masks. And he even says that probably between masks and vaccines, masks may be even more important. So please remember that masks should not be a political statement. They're just there to try to save people's lives. And I know they're a pain to use, but please do. Thank you.
And they're also available in handsome designer colors if you are so inclined.
Yeah, Bow Ties Unlimited has masks that match bow ties if you want.
There we go. You can be stylish as well as safe. Dr. Gervin Robertson from the Pharmacy Services Division over at Florida A&M. Your turn, sir.
Yes, I would end today with two aspects. When we talk about COVID-19 prevention, as Dr. Robinson is saying, and Claudia, as much as we can echo it all so that we won't have more and more parents like Cathy. With COVID-19, wearing a mask, I'm proud of Tallahassee, Florida. There are places I go when I go out of town and I walk into a place and I have my mask on and people look at me like I have three heads. But I wear my mask when I walk in those locations and I get all kind of weird looks. But wearing that mask, socially distancing, as Claudia states, hand hygiene, that's for the COVID-19 prevention until we have a widespread vaccine and even until it moves in throughout the community. And then as it relates to influenza vaccine, pneumococcal vaccine, those patients that are at high risk, if you're over the age of 65, you have diabetes, cardiovascular disease or some type of heart disease, if you're a cancer survivor, if you're on immunosuppressants because you've had a transplant surgery, you need to be having, if you've not had a pneumococcal in the last 5 years, pneumococcal vaccine and influenza vaccine each season. And I just like to preach that level of awareness to everybody.
Thank you so much, Doctor. Claudia Blackburn, the director of the Florida Department of Health in Leon County.
Well, I'd just like to remind everybody that, first of all, vaccinations are that's the super achievement for public health. Probably next to sanitation, the most important thing that's been that we have. And if you need to get immunized and you don't know where to go, you can call us at 850-404-6403 to make an appointment at the health department to get vaccinated. You can go to vaccinefinder.org. But the flu vaccine is safe and effective and recommended for everybody 6 months and over. And please, please, please get it done. Get it done before, the end of November, if at all possible.
Hopefully we will have something even more efficacious when it comes to the COVID-19 pandemic itself. And I know when that becomes available, you'll be standing by with your folks there to make sure that's as widely distributed as is humanly possible. Thanks so much, Claudia. And Cathy Mayfield, you get the last word since very few know more about vaccines than you.
I appreciate this opportunity. I'm just going to leave it very simply: educate, vaccinate, and let's do it. It's the right thing to do.
Folks, it's been a great discussion. Again, thanks to Claudia Blackburn, Florida Department of Health and Leon County Director, Dr. Gervin Robertson, the Division Director of Pharmacy Services, Florida A&M University, Dr. Paul Robinson, who is the past president of the American Academy of Pediatrics, Florida chapter, and again, Cathy Mayfield, mom of Lawson. And thank you for all you folks do to keep the level of awareness going as part of this program and the other multiple outreaches that you do. Thank you all for being part of this Remote Perspectives, folks.
Thanks, Tom.
Thank you.
all.
Thank you all.
Perspectives produced by WFSU Public Media in Tallahassee, and we also appreciate the help of Taylor Cox, Paul Dam, Amy Diaz de Villegas, Devin Bittner, Tricia Monahan, and Lydell Rawls, our Director of Content, and Executive Producer Kim Kelly. I'm Tom Flanigan. Now, our capital region has generally been impacted a little less than some of the other surrounding areas when it comes to the economic downturn resulting from the pandemic. But it's also a fact that the jobs that are coming will be somewhat different than the jobs that we've been losing. We're going to talk about getting ready for the jobs of the future next week on Perspectives. That's coming up from WFSU Public Media. Take care.